All right, so welcome back to Coffee with a Veteran. I'm Dave Rogers, your host, and I want to talk to you a little bit today about the VA Community Care Program. There's a lot of confusion amongst veterans on how this program works. Okay, now not everybody qualifies for this program. It's depending on your needs and also depending on what the VA in your area has to offer, but also how far away your VA is. All right, so there's a couple of different criterias there, and it gets kind of confusing. Um, but this is to hopefully give you a better understanding of how it works. So first of all, um, if you're a service-connected veteran, you probably are eligible for community care. But again, it depends on your needs. Okay, if you don't have a lot of issues, then you're just seeing your general doctor and you live close to your VA, they're probably not going to send you outside. All right. But some veterans live in very remote areas. Okay. And some veterans, some VA hospitals don't have certain clinics, or the clinics only run during certain times and maybe you work, or this is especially important for female veterans. I know a couple of VA hospitals that only have, male gynecologists. And if you're a woman veteran who dealt with MST, you may not want to, or you may not feel comfortable seeing a male gynecologist. Your VA may be, under 40 miles away, but it might be in a big city where there's still lots of traffic and it takes you over an hour to get to the VA. You know, the clinic may have limited resources. When I first started doing acupuncture at the VA, they only had one acupuncturist. She had a lot of patients, and you can only get a maximum of 3 treatments. But she felt that I needed more treatments than that, and so she recommended me to go outside of the VA. So recommendations can come from the clinics. A clinic doctor, you may see that clinic doctor initially and they'll say, listen, I can't provide this kind of care that you need, or have these many appointments, or, I have to send you outside for certain things because we don't have that equipment here at this facility. And so these are all things that qualify you for community care. Just because your primary care doctor does not feel that you are eligible for community care doesn't necessarily mean that's true. It's up to you to work with your doctor and to work with the VA to look at the situation in which you're in and determine what's best for you as the patient. Okay? Don't believe a lot of rumors. Don't believe a lot of people when they say, oh, you'll never get it, blah, 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 all this other stuff. The reason they set up community care is because not every VA hospital has everything that you need. And like I said, some veterans live very remotely. Okay. Some VAs may have the clinic that you need, but they're understaffed and they're overwhelmed and they can't provide you the amount of care that you need. And so these are all reasons why you're able to go outside of the VA, okay? And again, you might want certain care that your VA does not offer, and some veterans go, well, my VA doesn't offer it, I can't get it. Not necessarily true. Communicate with your primary care, talk to them, let them know your situation, let them know what's going on. For me with the acupuncture, I live in a lot of pain because I broke my neck and I have a lot of pain. And I found that acupuncture was a great way for me to relieve that pain without getting on pain medication. And so speaking to my primary care, I said, listen, I don't want to be on constant pain medication. I know the VA doesn't want to give me constant pain medication. So I would like to do acupuncture as an alternative to being on pain medication. They had me speak to the pain management team. They agreed with me. And now I get my acupuncture treatment outside of the VA because they're able to offer me more treatments than the VA can based on how many acupuncturists that they have. So make sure that you look into it. Make sure that you take care of yourself. And make sure that you get the care that you need. Until next time, hoorah.